Good evening, everyone. Thank you so much for joining us tonight here on News Channel 5+. I'm Casey Mason. Another open line for you this evening where you can call in and get the advice you need from the medical experts here on Ask the Expert. We'll have the phone number all evening right there on your screen. And joining us tonight, two very special guests we're very excited about introducing you to this evening. Let's go ahead and get to it. We have Jeremy Pitzer and Dr. Lucas Trautman joining us. Thanks for being here tonight.
Thank you so much for having us here.
Well, we've already been hanging out for about a half hour gearing up for tonight's show. This is actually your first time at News Channel 5, is that right?
It is.
Wonderful. We're excited to have you on this evening. And of course, our topic tonight, if you or someone you know is struggling with addiction, mental illness issues, please call in. If you have a story you want to share with us or any advice, free advice right here from two of the best experts in the field. Well, first of all, where are we coming from today? Tell us a little bit about yourselves.
So we are coming from the Oaks at La Paloma and Foundations Memphis and Foundations Nashville. So those are the three facilities that we work with that are part of the Foundations Recovery Network, which is the world's best recovery network, and we provide mental health and addictions treatment across the country.
And you know, Jeremy Pitzer, you are the CEO out there as well. Let's tell folks about that, your title and kind of your story, if you will.
Yeah. So that means he's my boss. He's the medical director. Yeah. So I've been with Foundations for a little bit over a year. I've been at the Oaks, and I previously was at another UHS facility. I'm a social worker. I'm a licensed clinical social worker in Tennessee, and so that's the perspective that I bring to our treatment team and to our facility and just to the addictions work that we do in the community.
All right, let's go ahead and get to you, Dr. Lucas Trautman. Tell us a little bit about yourself, kind of what got you into this line of work. We're excited to hear from you tonight. We're going to have a lot of great questions coming in soon.
Thank you, Casey. So I'm a psychiatrist. I'm the medical director of the Oaks at La Paloma, and I got into this work because I saw there was such a need for addiction services. So many people that I treated and knew when I started off in pediatrics and general medicine, I saw such a need and an absence of people who really cared about treating patients with addiction and mental health disorders. So I naturally went into it because it brings me joy to treat people. You know, what we do at the Oaks at La Paloma and Foundations is we bring a very patient-centered approach. Instead of a rigid, just one-size-fits-all, we meet the patient where they are. And I love that because I think that's the way to get best outcomes.
That's right. And you know, one thing about tonight's show too, I want to go ahead and remind folks, you can call in right here to the Plus. You'll be live on air, completely confidential. You don't have to say your name if you have a question that you may or a concern. But also, there is a number to Foundations Recovery Network I want to go ahead and let you know about. We'll have a graphic with their information. It'll pop up on the screen. And that's a number that you can reach out to anytime, and experts are more than happy to hear from you. If you're not comfortable calling in tonight, which is perfectly fine. Well, let's go ahead and get started. So first of all, I want to talk about what exactly Foundations Recovery Network and the Oaks, as you abbreviated the Oaks, is. Let's hear a little bit about both and kind of a background, if you will.
Yeah, we really are a continuum of care across the country. So we have 6 residential facilities and I think 13 outpatient facilities, really California, Tennessee, Michigan, Chicago, Atlanta, really all over to provide the services across the country. So our patients are just like you and me. They're really, addiction crosses all socioeconomic bounds and age and gender, and so the people that we work with are your listeners and people in our communities. And
I think it's great that you have so many locations, both locally and nationally. The locations right here for our viewers tonight, the Middle Tennessee, if you want to let folks know where they can find you all at.
Yeah, so that's our Foundations Nashville program. It is an IOP. It's in a beautiful downtown building, an old historic mansion, and we have some of the best and most skilled, competent therapists there. Really caring, cool environment. And
you know, you can look up the Oaks. I actually did that before tonight's show, and you guys have a great website. You're on Facebook, and some great videos as well with you and them kind of describing more about the facility and the locations. And yeah, definitely feel free to check that out tonight. I highly encourage that, actually. So let's talk about the patient population. Both kind of a question for both of you, your take as CEO and doctor. You know, it's very interesting. What does it look like? And I ask that because really I think I know the answer, and it doesn't have a look. It's everyone.
Absolutely. It's a family member or a teacher or your attorney or anyone in your life that could potentially be affected by this. And so that's what makes the work so enjoyable and fulfilling. You have people coming into treatment, you know, with sometimes the darkest hour of their lives, and we're there to greet them, and we're passionate about that. And so during the time they're in treatment with us, we see transformations, and it's so inspiring to see that.
I can't even imagine how rewarding, you know, this line of work must be for you both.
Absolutely, truly.
Tremendously.
Can you walk us through kind of a day-to-day, what it's like for you, kind of just a day-to-day for you both?
Sure. At the Oaks, so it's a residential treatment campus. So we have yoga, we have workout facility, we have a recording studio, an art therapy program, and so of course we have therapists and psychiatric nurse practitioners and psychiatrists, but it's a wraparound program for the whole person. You know, and so part of the day might be individual therapy, part of the day might be a visit with a medication management doctor, but a lot of it may be creating artwork or doing a yoga class or going to the gym and working out, taking a walk around the campus. There's so much programming, sun up to sundown, that we treat the whole person, and it's so inspiring.
That is incredible. It sounds absolutely fantastic.
Yeah, I would say our creative therapies program are really at the core of what we do and really sets us apart. Most facilities are going to have good treatment and good therapy, but the things that Dr. Trautman was talking about, the art therapy and the music therapy, really are at the center of this. So we do art therapy, we do music therapy, which includes drum circle, studio time, variety shows, and you would be surprised. You don't have to be a musician or be able to sing or play an instrument to benefit from this program. It's a really cool way to enhance the healing process.
Would you say this is unique? Oh, go ahead. Go ahead.
Yesterday, so you reminded me. Yesterday, I walked in the building, and right there where I walked in, over to the right is near the music studio, and there was someone playing the guitar, rehearsing. And I listened back there. It was some kind of blues guitar, and then somebody with no drum experience was being included, and they were creating a band right there. And then our music therapist was singing with them. It was so beautiful. They were just doing it.
You know, say you're someone new to this, you've never been to a treatment facility. Why have those things? I mean, obviously it's fun to have those types of activities, but I'm sure there's more of a method to that, right?
Absolutely. Absolutely.
So the lady that Rachel Pinter is her name. She's a licensed musical therapist, and she's speaking at our conference that's coming up in August, which is Innovations in Behavioral Health. It allows people to focus on some of the other aspects of themselves that they don't get in therapy, just to sort of be one with their self and their emotions, and it allows a different venue of expressing those things, whether it's trauma or the addiction histories or all those things, in a way that's different from just the talk therapy. So it really helps people get out some of that stuff, and it's beautiful to see. It really is.
Great. Well, I feel like, you know, we are kicking the show off on the right note. I mean, just letting kind of folks know who our guests are tonight. Lots of great information ahead. We're going to talk about some events coming up. Just talk about some general issues right now, some that are kind of high in the media right now. Maybe some things that, you know, we just want you to take away from tonight's show. Again, the number's right there on your screen. You can call into us live. A lot of times we have folks call in not so much for themselves, but on behalf of a loved one. I think an important conversation that we typically like to have is, how do you approach that conversation? And don't worry, right sitting next to me, they can answer that question for you. Lots of great tips coming your way. Well, let's move forward now. I want to talk about supportive therapy. Is that something you wanted to address tonight? What exactly is it? So
yeah, it's some of the things that have already come up. So built into our schedule is yoga's 5 days a week, and I don't know what the research exactly says about the yoga. I just know that being mindful and mindfulness exercises are really helpful towards the healing process. We have Tai Chi a couple times a week, in addition to the music therapy and the art therapy. We have a low ropes adventure course. We do some grief and loss work that patients can elect to participate in. It's not mandatory. And then some other supportive trauma therapies that are somewhat optional. So all those things come together to really support the traditional group therapy and individual therapy and medication management and all those things. It's really what sets us apart.
Wonderful.
And you know, you asked, talked about the research for yoga and meditation and things like that. Contemplative prayer is another one that falls into that category. So when people slow down and they have more silence in their life, You know, we've got so much traffic and iPhone and, you know, screen time and everything. When people slow down, we have demonstrated neurotransmitter change in the brain. And so it's really nothing modern that we're doing. You know, our grandparents used to sit on the porch and be quiet, or if your great-grandparent was a farmer out in the field, they got that naturally. They didn't have constant stimulation. And so that's something we really focus on, is slowing life down so you can be mindful and, you know, and heal, truly.
Something I think we all could focus on. Now, we actually do have our first caller right now. I believe we have Joey. Hi, Joey. Thanks for calling in. You're live on OpenLine.
Yes, Sam. Hi. How y'all doing? I live up in Macomb County, and it's pretty bad up here, you know, with the pills and everything, and a lot of people are addicted. And my question is, what would somebody do without insurance? Because a lot of people out here don't have insurance to go to a place like what you're talking about, you know.
Yeah, that's a great question. Thank you so much for calling in, Joey. I'm going to let you guys take that away.
Sure. Yeah, I would still encourage them to call. So we do really have, you mentioned our call center that's standing by, and they're there 24 hours a day, every day. 24
hours a day, very important.
24 hours a day, 24/7, 365. They are experts, they're really good, and even if we aren't the right place for somebody that calls, they are able to leverage resources across the country and get people linked up in their community, in their county, depending on, you know, what type of insurance they have or no insurance, and finding, you know, programs that either have a sliding scale or that fit for their budget. So call.
I 100% agree with that. And Joey, because you may not know where the grant money is or what programs are there for the people that you're referring to, linking up with an expert who has those relationships and knows where they are, that's the first step for the people you're talking about.
Yeah, that was a great call. We really appreciate you calling in tonight, Joey, and thank you for tuning in. We really do appreciate that. Let's go ahead and take our first quick break of the night, but just keep it right here on News Channel 5+. We have a lot more we want to get to, a lot we want to share with you, and we'll be right back here on OpenLine.